and staff, including our outsourced working with the central government, to download Arogya Setu app on their mobile phones immediately for breaking the chain of transmission of COVID-19. Active cases of coronavirus in India now stand at 22,629. 1,007 deaths reported from across the country. 7,695 patients cured and discharged. Global tally of confirmed COVID-19 cases goes past 31 lakh with over 2,17,000 deaths. The United States is the worst hit with over 58,000 deaths, followed by Italy, Spain and France. US President Donald Trump announces that the state of Texas will start reopening businesses in a phased manner from Friday, and says that many states are moving to reopen safely and quickly. In some other news, renowned film actor Irfan Khan passes away in Mumbai at the age of 53 after fighting a long battle with cancer. The famous film director Shujit Sarkar tweets, giving out the news of Irfan Khan's demise. INB Minister Prasar Bharati expresses condolences on Irfan's demise. And Union INB Minister Prasar Bharati says the Modi government has not waived off even a single penny of willful defaulters. Says writing off is neither a waiver nor a clean chit to the defaulter, and it doesn't stop banks from making efforts to recover the amount. The Finance Minister Nirmala Sitharaman says the Congress is misleading on willful defaulters, bad loans and write-offs. The Union HRD Minister Ramesh Pokhriyal Nishank announces midday meal or its equivalent food security allowance will be provided to children even during summer vacations. During a video conference with state education ministers, the Union Minister says the decision will benefit about 11.5 crore children. Namaskar and welcome. Thank you for joining us here on the Midday News. I'm Mark Lynn. Let's begin with some bad news, shocking news. In fact, India has lost its versatile actor Irfan Khan. The actor Irfan Khan was fighting cancer for the past 2 years, but lost that fight this morning. He was 53 years old. He was admitted yesterday to the ICU of the Kokilaben Hospital in Mumbai after having been struck in 2018 with the news of a rare cancer. He took life soon after as it came, and he fought on with many battles. He, in fact, had tweeted, "I trust I have surrendered." These were some of the many words that Irfan Khan expressed in a heartfelt note that he wrote in 2018, opening up about his fight against cancer. He left for his heavenly abode, leaving behind a legacy, said his family. Angrezi Medium was the last film that he had acted in. Irfan Khan received the Padma Shri in 2011 for his excellence in the arts. And later in 2013, he was awarded with the Best Actor Award in the National Film Awards for his outstanding performance in Pan Singh Tomar. His other movies, Talwar, Piku, Lunchbox, Hindi Medium, are considered classics. Irfan Khan was a man of few words and an actor of silent expressions with his deep eyes and his memorable actions on screen. He has left behind a truly big legacy of his own. Expressing sadness over the demise of the Bollywood actor Irfan Khan, the Union Minister Prasar Bharati took to Twitter and paid tributes to the actor. The Union Minister said that Irfan Khan was a versatile actor and he is sorry to hear about the demise. He also extended his heartfelt condolences to Irfan Khan's family, friends and fans. Expressing his sadness over the demise of the Bollywood actor Irfan Khan, Amitabh Bachchan took to Twitter to pay tributes to the actor. The actor said that this is a most disturbing bit and sad news. He also described him as an incredible talent, a gracious colleague and a prolific contributor to the world of cinema. The actor further expressed grief and he said that Irfan Khan left us too soon, creating a huge vacuum. Also, actor Akshay Kumar expressed his condolences over Irfan Khan's demise. The actor said, "This is such terrible news," and also that he is saddened to hear that about Khan's demise. Akshay Kumar hoped that God would give strength to the family in difficult times. Moving on to our next story then, the centre has asked all its officers and staff working with central government to download the Arogya Setu app. The Ministry of Personal, Public Grievances and Pensions has issued a memorandum stating to mandatory all central government employees to download the Arogya Setu app, review status on the app before starting for office. Working in the central government must download the Arogya Setu app on their phones. The officers and staff should review the status of the app before starting for the office and commute only when the app shows safe or low-risk status. If the app shows that the person is in moderate or high-risk zones, they should not go to the office and self-isolate for 14 days or till the status becomes safe or low-risk. Joint Secretary of Administration shall ensure strict compliance. Similar instructions shall be issued to all autonomous statutory bodies, PSUs, and those attached to various ministries. The Union HRD Minister Ramesh Pokhriyal Nishank held a video conference with state education ministers and discussed issues related to COVID-19 and the midday meal program. He said that the complete syllabus of the CBSE and NCERT is available on Diksha portal.
सीबीएसई एनसीईआरटी का पूरा पाठ्यक्रम दीक्षा पोर्टल पर आपको मिल जाएगा। एक राज्य को छोड़कर के देश के सभी राज्यों ने दीक्षा पोर्टल पर अपने को जोड़ा है और वो विद्यादान वन करके हम लोगों ने इसको शुरू किया था और मुझे इस बात को कहते हुए बहुत खुशी है दीक्षा पोर्टल के माध्यम से हम पूरे देश के छात्रों को दे पा रहे हैं।
The HRD minister also announced that midday meal or its equivalent food security allowance will be provided to children even during the summer vacations. This will meet the nutritional requirements of eligible children under the midday meal scheme in order to safeguard their immunity, which is very vital during the COVID-19 outbreak. This will benefit about 11.5 crore children studying in class 1 to 8 in 11.34 lakh schools across the country. The central government will provide additional funds of about 958 crore rupees and 3 lakh metric tons of food grains worth approximately 990 crore rupees towards this end. And now let's give you an update on the cases of the latest update from the Health Ministry. The active cases of COVID-19 in India stand at 22,629 with 1,007 deaths reported from across the country, while 7,695 patients have been cured and discharged. And with this, India's recovery rate has climbed further to 23.3% with more and more patients recovering. The total number of positive cases in Assam, the number stands at 68. However, with the discharge of 27 persons, the total positive cases in Assam, the total positive cases is only 10, while 1 person died. The recovery rates in Assam so far are 77%, which is quite good. And the state cabinet yesterday took several steps to strictly enforce the lockdown, while also allowing rural activities. Here's a ground report from Assam.
In a state cabinet meeting held on Monday, it was decided that the 5 red zone districts will be enforced with complete lockdown, and those green zone and orange zone districts, in those areas, the rural areas can open the shops but not markets. Those people stranded due to lockdown in various districts have able to come to their own districts, and around 30,000 people applied for the e-passes and they have returned to their own districts as on Tuesday. The Chief Secretary of Assam have strictly mentioned that those traveling without e-valid passes will be directly put under quarantine. Chief Minister Sarbananda Sonowal and Health Minister Dr. Himanta Biswa Sharma, they have been constantly monitoring the whole COVID-19 situation in Assam. With camera person Rishu Singh, this is Reena reporting for DD News.
So the total number of positive cases in Assam is at 38. Now moving on to our next story then. In their outreach to provide everyone with basic essentials in the Union Territory of Ladakh, the Lieutenant Governor R.K. Mathur launched a campaign of distributing masks to all Antodaya beneficiaries and migrant laborers in Leh. The Lieutenant Governor handed over 2 reusable cotton masks to Antodaya beneficiaries and migrant laborers from Doda district working in Ladakh. And over 30,000 Antodaya beneficiaries and 14,000 migrant laborers working in Ladakh will be provided with the masks from the LG Relief Fund. And distributing the masks, the LG said that this is in response to the Prime Minister Narendra Modi's call to wear masks as a precautionary measure to stop the spread of the novel coronavirus. The UT administration has also decided to provide financial assistance of 10,000 rupees from the LG Fund to 5 needy patients undergoing treatment outside of Ladakh. The number of COVID-19 cases is on the rise in Pune, Maharashtra, even after the high alert. In such a situation, the Sardar Vallabhbhai Patel Hospital of Pune Cantonment Board has undertaken the help of someone who not only is serving patients suffering from COVID-19 but also providing relief to the staff. It's a robot. Here's the story.
As the number of coronavirus cases in Maharashtra is on the rise, hospitals are coming up with innovative ways to assist patient and staff. In order to reduce the exposure between the patient and staff, the ITI department of the Pune Cantonment Board have developed an indigenous low-cost robot. Sardar Vallabhbhai Patel Hospital have dedicated a special ward equipped with 100 beds for COVID-19 patients. There are around 70 COVID-19 patients in the hospital. The robot has been tested successfully and is working in full potential in the special ward.
हम लोग काफ़ी प्रयास कर रहे थे काफ़ी समय से कि हम कोई हाई एंड रोबोट कुछ अदर स्टेट्स में जैसे कि राजस्थान में, केरला में और तमिलनाडु में है, लेकिन लॉकडाउन इश्यूज़ की वजह से उसका प्रोक्योरमेंट में बहुत दिक्कत आ रही थी। तो ऐसे में जो हमारे आईटीआई की टीम है और आईटीआई जो प्रिंसिपल हैं, इन्होंने उस समस्या को समझा और इन्होंने इस चैलेंज को स्वीकारा और इन्होंने इन हाउस उसको एक असेंबल करके एक रोबोट बनाने की कोशिश की, जिससे कि ज़्यादा से ज़्यादा पेशेंट्स को सर्विसेज दी जा सके बिना उनको एक्सपोज किए हुए जो हेल्थ वर्कर्स हमारे हैं।
The hospital staff thanked the ITI department for the robot. The robot has been developed for reducing the staff patient exposure. The cost-effective robot has been developed with a total cost of only 45,000 rupees.
रोबोट रहने की वजह से नर्सिंग स्टाफ है और आया नर्सिंग ऑर्डिले है, उनका एक्सपोजर बहुत ज़्यादा कम हो रहा है, क्योंकि पेशेंट को खाना देना, उसके बाद में उनको मेडिसिन दे देना, वहाँ तक जाना, उनको कुछ ज़रूरत है तो ज़रूरती चीज़ें वहाँ तक पहुँचाना, इसमें जो एक्सपोजर होता था वो बहुत काफ़ी कम हुआ है।
At a time when the centre and the state governments are working day in and out to contain the spread of the virus, such an initiative not only boosts the morale of the staff but also brings in a ray of hope. With Shama Mishra in Pune, DD India.
In these unusual times, we take up different practices as precautions against the novel coronavirus, and people are coming up with new and innovative ways of coping. So in response to the Prime Minister's call for the lockdown to ensure the welfare of all, a Chetti Tirukonam village in Ariyullur village of Tamil Nadu has decided not to step outside of the village limits, even for essentials. Instead, the villagers have turned adversity into opportunity, and they've returned to the barter system of old. So the villagers are in their homes, and this is a home to over 400 families living in this village who exchange agricultural produce cultivated on their farms with each other. The farmers do not take their goods to the market to sell outside. They just exchange it for articles that they need. So far, it's doing them a good job. It's serving them well. In a good news story from Mizoram, people are seen saluting the Chennai ambulance driver who travelled more than 3,000 kilometers from Chennai to Aizawl. Rafael accompanied his friend Vivian's body when it was brought back in an ambulance after the latter passed away in Chennai. Social media groups of the Mission Wing locality in Aizawl expressed their gratitude and gifted Rafael the traditional Thavlo Puan and a cash prize and a cash contribution worth 21,700 rupees. They also honoured the two Chennai drivers with Mizo traditional attire, and they gifted 5,000 rupees each to them. In Uttarakhand, amidst the lockdown, the portals of the Kedarnath temple opened early in the morning. So the portals, however, opened strictly for performing the rituals and not for devotees. The decorated temple will, however, only host the chief priest of the temple along with a few other priests. Darshan will not be allowed for the devotees as of now due to the COVID-19 outbreak. The portals of the Kedarnath temple were opened at 6:10 in the morning. Darshan of the devotees is not allowed as the temple is closed. Union Minister Prakash Javadekar slammed Congress leader Rahul Gandhi for spreading false information regarding willful defaulters. The minister said that there is a difference between writing off a bad loan and waiving off a bad loan, which Rahul Gandhi doesn't seem to understand. He said that no loan has been waived off. Instead, the properties of the willful defaulters are being seized.
Rahul Gandhi's comment that Modi government has waived off 65,000 crore rupees. Not a single paisa has been waived off. Writing off is not waiving off. Chidambaram must take a tuition. And he must understand that this is not waiver. Writing off is a process of accounting where the account which has gone, which is in default, is taken off the book. But it is not to give him clean sheet or give him a certificate that there is no dues. Nirav Modi's assets are seized, they are auctioned, he is in jail in London. Mallya has now left with no choice but to come back because his appeal in High Court has been rejected. So there is action going on in each case.
Earlier, the Union Finance Minister Nirmala Sitharaman had criticized the Congress leader Rahul Gandhi for misleading the people by sensationalizing facts and taking reports out of context. In a series of tweets, the finance minister said that provisions are made for NPAs as per the 4-year provisioning cycle laid down by the Reserve Bank of India. Upon full provisioning being done, banks write off the fully provided non-performing assets but continue to pursue recovery against the borrower. No loan is waived off. Dissecting certain high-profile cases, Sitharaman said that the Modi government had taken steps to recover money through various steps, such as seizing, attaching and auctioning various assets and possessions. She added that extradition requests had also been made to the countries the defaulters were living in. The finance minister also mentioned in detail about cases of Nirav Modi, Mehul Choksi and Vijay Mallya. In case of Nirav Modi, she said that his immovable and movable properties were attached or seized, and he is in prison in the UK. In Mehul Choksi's case, Sitharaman stated that his properties have also been attached and seized. A red notice has been issued against him. An extradition request has been sent to Antigua. The hearing for declaration of Mehul Choksi as a fugitive offender is in progress. In Vijay Mallya's case, Sitharaman said, Mallya has been a declared fugitive offender. On extradition request by the Government of India, the UK High Court has also ruled for extradition. His properties have already been attached and seized. The Finance Minister in another tweet said The total value of attachment of and the seizures of these properties in case of Nirav Modi, Mehul Choksi and Vijay Mallya is 18,332.7 crore rupees. She further added that it is the Narendra Modi government which is pursuing these willful defaulters. Speaking about reopening the economy, the US President Donald Trump took to Twitter to inform people that several states of the country, of the United States, are on their way to reopening, and that too safely. The US President said that Texas is ready to resume its work in phases from the 1st of May. He also referred to the Texas Governor Greg Abbott's plan of three-phased opening of the state. The restaurants, retailers, movie theaters and malls in the state will open to the public till their 25% capacity to allow the practice of social distancing. The stay-at-home order in Texas will expire on April 30, but bars, saloons, gyms will still remain closed. Meanwhile, the president has said that the United States was considering having passengers on international flights from coronavirus hotspots to be tested for the virus. Meanwhile, the US has reached yet another troubling milestone on Tuesday as confirmed coronavirus cases topped 1 million. According to Johns Hopkins University, over 58,356 fatalities due to COVID-19 have been reported. The total number of people who have recovered stands at 1,15,572. In the meantime, the US's Air Force elite flying squad, the Thunderbirds, and the Navy's Blue Angels flew over New York and New Jersey to thank first responders, military personnel, and essential workers who have been on the front lines of the novel coronavirus pandemic. The flying demonstration squadrons made a formation of 6 F-16CD Fighting Falcon and 6 F-18CD Hornet aircraft for a 40-minute flyover. The coronavirus death toll in Brazil has crossed the 5,000 mark. The Health Ministry of Brazil has confirmed the number has now surpassed that of China. Brazil is the worst hit South American country due to COVID-19 pandemic. The number of total cases is around 72,000. Experts believe the overall number of COVID-19 cases could be 12 to 15 times higher due to the large number of undetected cases, given the lack of testing available across the country. The country has 210 million people in its population. Meanwhile, another crisis has hit the Latin American country as people are discontented with the President Bolsonaro's handling of the coronavirus epidemic. Many believe that he should resign. Our next story. The coronavirus death toll has reached 21,678 in the United Kingdom. The UK has the 5th highest death toll in the world. The total number of infected cases is over 1.6 lakh. The Health Minister Matt Hancock on Tuesday said that in view of the current situation, there is no short-term end in sight for the lockdown. Hancock added that Britain would publish data on the deaths in care homes and in the community every day from today onwards. He also said that the UK was one of the leading countries in the race to find drugs that are able to combat coronavirus symptoms, and a new phase of clinical trials involving one possible treatment had begun on Tuesday. He added that the death and infection rate wasn't low enough to contemplate reopening of schools. Meanwhile, hospitals, trains, stations and fire brigades, they fell silent across the UK on Tuesday as a tribute to the National Health Service and other key workers who have died from COVID-19. 98 healthcare and care service workers, they have died after testing positive for the virus in the UK. With that, we conclude this bulletin. Thank you for being with us. Namaskar.